TB for PSI Global, Byron Austin, Executive Director of Corporate Responsibility and ESG Management with Organon, and Dr. Samukeliso Dube, Director of FP2030. This conversation on closing gaps in women's health will be moderated by Dr. Mayesha Alam, Vice President of Research for FP Analytics with Foreign Policy.
Hi, everybody, and thank you so much for being here. I'm really excited to have this discussion on a really important topic, women's health, with such an illustrious set of panelists. So let's dive right in. Samukeliso, I'm going to actually begin with you. As Executive Director of FP2030, your organization has been at the forefront of a rights-based approach to family planning. So can you tell us, how does FP2030 view women's rights from a human rights perspective? And how does this perspective shape your approach to women's health across the different stages of a woman's life?
Thank you very much, and good afternoon, everybody. Just glad for this opportunity as FP2030 to be part of this panel. FP2030 is the only global partnership that is focused solely on family planning within the broader women's rights, reproductive health framework. We are founded from the principle that everyone, every woman, every young person, every person everywhere in the world has a right to determine if, when, and with whom they want to have children. And that is fundamental to human rights. So we believe that women's rights should equally be framed within the broader human rights agenda, because fundamentally, women are also human, and that for us is important. Having a right to control your own fertility as a person and make your own decisions about whether you want to have children, and regardless of your partnership status, regardless of your age, where you come from, your socioeconomic status, and even your identity, is fundamental to what we believe in as FP2030. Now, I believe also there is a powerful link that we have made as an organization between access to voluntary modern contraception and other human rights that you have seen as we are advancing the Sustainable Development Agenda. But this particular link, we need to somehow action it. And this is obviously a link to gender equality. First, we start with a link to health, because we believe that access to family planning, to modern contraception, actually would do more for women's health in general, for maternal mortality reduction, for neonatal and child mortality reduction, and that is important. But also we have seen that giving a woman the ability to determine if and when she wants to have children could be a deciding factor whether she could finish her education, have access to college or even finish college, have access to a job or even hold a job. It makes sense, right? Women cannot stay in school or participate in the workforce or even provide for their families in the way they would like if they do not have time and space in their pregnancies. As a collective, we are not able to make progress on these other human rights markers that we are all espousing to if we do not make progress on family planning. And that is why family planning must sit at the very center of the development agenda. And my colleagues in the panel would attest that there is also a need for us to make sure we work together and cut across different care streams of work if we are to make this goal a reality. And you know what? It may sound simple as I speak about it, but when we have and we espouse towards integrated, people-centered healthcare, that would actually make the single greatest impact on women's health, which is just broader than sexual health and reproductive rights. We know that when a woman is pregnant, it actually would affect even some of the comorbidities that she may have, cardiovascular morbidities, or even some of the metabolic disorders. So we know that the ability to decide around your pregnancy is important for other health indicators and even global health systems overall. That's why we believe that family planning is key. And lastly, it starts well before you attend the clinic. It's the whole ecosystem around a woman's life. As we start in the whole girl effect, I'm sure you've seen that video, or the life cycle of a woman when she was young, when she needs to actually take care of her children, or if she wants to go back to work, or if she wants to finish college, etc. That whole system, we need to program it better. With my colleagues here from PSI, Organon, they are advancing some of these products. It starts well before the clinic. Donors, policymakers, private sector, NGOs, and everyone who works in this space, we need to work together to make sure that we disintegrate these silos and ensure that we provide comprehensive women's health package. And at the core of that, there is family planning. So that's how and why we're at the forefront of a rights-based approach, which is the ability to choose and decide about your own fertility.
Thank you for that. And I think there's so much there to unpack, whether that's about healthcare over the course of a woman's life, primary health, the social and economic aspects. And I'd love to bring our fellow panelists into this conversation to pick up on some of those themes. And Jen, I'm going to turn to you next. Can you help us understand what consumer-powered healthcare looks like in the context of women's health? And how does PSI Global design and implement programs with a woman-centric approach? Are there any examples that you can share or best practices to help people make sense of those concepts and what they look like in practice?
Great. Yeah, no, thank you. And thank you, Dr. Dube. Everything you said really resonates. I think when we think of consumer-powered healthcare, it's really putting her at the center and understanding her needs, which requires us to listen. Often, over time, programs are designed thinking we know what's best. And how do we really listen to what are her needs, what are her challenges, looking at her whole self? And it's putting the power in her hands so that she has agency, choice, and voice to make her own decisions. And so as we listen and include them in women in programming what they need, it's thinking about how do we flip the health system to really work for her? What's needed? And so that means we might have to expand and innovate of how we're reaching her so that care is designed based on what she needs across her life course, not just for family planning, but across the sexual reproductive health continuum, maternal health, or what have you, and really thinking about what are the needs that each person has in the different segments, because each person is different and there could be different stigma associated if you think about youth, for instance, and accessing sexual reproductive health. And so we really work with the different people with whom we want to make sure the system is serving. And part of that is thinking through, for instance, with COVID, we saw how fragile the health system was, and thinking about how do we expand what we mean by the health system? How do we have meaningful engagement with the private sector? Because we know that a lot of people access their care through the private sector. And how do we deliver public health goals through that? And think about even self-managed care and what that means and how we leverage digital tools to really strengthen that entire ecosystem. But I think when we come back to consumer-powered healthcare, it's also thinking about how do we hear her voice? What feedback are we getting? How do we ensure empathetic care? And the workforce is really responsive to her needs and the system. And so for us at PSI, we have goals of reaching 100 million users by 2030 in partnership with FP2030 and other partners like Organon. And it really, in order to do that, we need partnership. And partnership starts with her and involving her in the programming.
I love that, and I think it's a perfect segue to my next question, this idea of empathetic care, what that looks like, and what that looks like with partnership at the core. So Byron, I'm gonna go to you next. And from your perspective as Executive Director of Corporate Responsibility and ESG Management at Organon, what's the role of the private sector, whether as a commodity, information, service provider, when it comes to women's health? And where do you see the private sector contributing to the broader goal of equitable health care for women?
Absolutely. No, thank you for having me at this great conversation. And I think Jen and Dr. Dube said it very well, that it's about putting women at the center and listening to women. Organon is a global pharmaceutical company focused on women's health. We were founded through a spinoff of Merck, or MSD, in June of 2021. So we just celebrated our second birthday. And we were founded on a promise that 4 billion women and girls can achieve their promise through better health. And we really started out on that journey by listening to women, not only their doctors, but also women themselves. And hearing what are their health needs, what are the areas for more investment along a woman's lifespan, and not only in contraception, which is very near and dear to our hearts. We have a contraceptive, long-acting, reversible contraceptive product, but also in areas such as preterm labor, postpartum hemorrhage, endometriosis, menopause. And this is all, we learned this through clinical research, but we also learned it by just talking to women around what are the different challenges that they face from a health perspective. But focusing on family planning, which both Jen and Dr. Dube said very well, it really is the center of everything. And it really inspired us to also make a commitment to FP2030 of reaching 100 million women with our contraceptive products by 2030. And I'm happy to announce that we're actually almost halfway there by reaching 47 million women last year. And so we really believe that it is important to meet women where they are, and that is really, if they show up in the public sector, if they show up in the private sector, where in many countries, in many low-income countries, they access care through private providers for whatever reason, because of stigma of the public health sector, or some idea of confidentiality in the private sector for whatever reason. And so we want to make sure that our products and our services are there wherever she may be. And I think it goes back down to consumer-centric care. It really is about where do they want to access care, given their local geographies, given where they feel most comfortable. And so we're really excited to work in partners with PSI, with FP2030, with many NGOs, with other private sector companies, with governments, to make sure that not only are we providing care, but also that women's healthcare stays on the political agenda. And that's when we work with governments around the world to make sure that they're allocating the necessary resources and funds to help women thrive, because we know when women thrive, economies thrive.
Well, I couldn't have picked a better transition to what was going to be my next question, and in particular, picking up on these ideas of women's health on the political agenda and the relationship to the economy. And this is a question for all of you, and maybe Samu will go to you first, but investments in women's health impact not only their well-being, but that of society writ large and the economies in which they live, at the local level, at the national level, and beyond. There's extensive evidence and research to demonstrate that. Can you help us understand how investments in women's health specifically contribute to broader economic prosperity? How do we ensure that the impact is scaled up, and that what women want and need in terms of healthcare stays on the political agenda? So, Samu, maybe we'll go to you first and then come back to the other panelists.
Thank you very much for that question. And you are spot on. We know that if you invest in healthcare in general, you will achieve economic prosperity. That iteration, whether it's through some of the seminal papers from people like Jeffrey Sachs, etc., we know that investment in health actually contributes more to the economy. But how about women's health specifically? So there are many institutions that are working around family planning, reproductive health, that are articulating that economic equation, and successfully so. We know that there is evidence that if you invest so much in family planning, you get it back, a return on investment for maternal health and for some of the human development indicators at a country level. Our job as FP 2030 is to ensure that not only does this stay high on the political agenda, but that in any other global initiative, for example, we're looking at universal health coverage, we are looking at the ICPD mechanisms, we are looking at even some of the work that we are doing on the sidelines with McKinsey, etc., around investments. What is that investment case that needs to happen at a country level for us to achieve some of these goals? We are doing that on the sidelines to make sure that for governments in Africa, in Asia, they do allocate specific investments for women's health. Now, the challenge that we are having is when you say women's health, it becomes broad, right? For some of us, it can be easy to articulate it as family planning, reproductive health, etc. But it can actually be broader than that. It could be how women, are affected by arthritis, different from men, by cardiovascular diseases. Is it different from men? But if we actually circumscribe it and just say, this is what it contains for FP 2030, we are a global movement. And our way of work is to get countries to make an FP 2030 commitment that ensures that the family planning and reproductive health agenda stays firmly on the political agenda. These commitments are signed by presidents, and we are trying to do right now some peer-to-peer influence by getting some of the presidents in Africa to actually influence each other around these investments. We've got a global collective that actually ensures that, exemplars in doing this better are amplified at a global level. And there are some initiatives that, Dr. Maria, about, like universal health coverage, to make sure that as these initiatives accelerate, family planning and women's health is actually costed and it's included in these agendas. We do that by working with civil society, focal point structures at a country level, and having our champions all over the world. Global FP 2030 is global, working with presidents in Africa, and we're trying initiatives with football players. We're trying initiatives at a global level, but governments are now sort of conscious that investing in women's health will have tangible translation in economic growth.
Thank you for that. And let me see, Jen and Byron, if you'd like to add anything to that from your perspectives as well.
Sure, I think we can't achieve the Sustainable Development Goals if women's health isn't taken as a priority, and that we have comprehensive care and access to services across the continuum of what she needs. We can't pick certain parts and not, because she's a whole self. And I think we've found a lot in our work with PSI, for instance, we work a lot with adolescents and youth. And quite frankly, if you ask them what are they concerned about, health isn't the top priority, but they're thinking about how do I get access to school, continued schooling, or financial sustainability, or different skills. And so we work in a lot of our programs of integrating those programs and showcasing that actually access to contraception, strong health is one pathway to better opportunities in terms of education, or teaching them different skills so that they understand that there's a path that's maybe different or in their dreams. And I think, it's really critical that we look across the board in terms of how we're investing, how we're better integrating in different ministries of health and ministries of planning and youth, and across the board of coming really together and say, this is helping, what do we need as a country? What is the support that we can get? And what are those innovations that will help us achieve that? And I think going back often, women are the cornerstone to anything in the development. If their needs aren't being served, we're not going to be able to reach, economic prosperity, development goals, and, the broader universal health coverage. And so I think it's really critical that we think through that and continue to advocate and support women and listen, most importantly, to what they need.
And I just add to that from a private sector, from a business perspective, women are customers. There's a lot of, it's not only the right thing to do, there's a lot of money to be made. And there's been they're not just beneficiaries, they are customers, and that they should be listened to as consumers. And so we've been working with not only governments, but other private sector players to say, invest in women, because there's an economic case to be made for your own benefit, for the benefit of your own country's economy, and in doing so, that we're going to expand the pie, right? We're going to hopefully get more dollars into research and development, and we've been having these conversations with investors who not all investors have woke up to the fact that half the world is sidelined in terms of a consumer base. And so we're really hoping to change that narrative.
I love that point. Seeing women not just as beneficiaries, but indeed their agency, their purchasing power, and their decision-making power as well are really, really fantastic points. Before we wrap up, I want to pick up on a couple of threads that actually each of you highlighted. For example, Jen, earlier you were talking about the SDGs, the Sustainable Development Goals. And we know that Goal 3 on health and Goal 5 on gender equality are inextricably linked. Earlier, Samu, you were talking about the fact that this isn't just about reproductive health. Yes, that's absolutely central, but it's everything from non-communicable diseases to how we get to universal health coverage. And this is something that my team at FP Analytics, the Independent Research Division of Foreign Policy, has done quite a bit of work on as well. And so as a final question to all of you, let me ask you this. With the UN's high-level meeting on universal health coverage planned for later this year, and knowing that this is on the agenda of the UN General Assembly, that it was on the agenda of the World Health Assembly, could you elaborate on the broader context of your ongoing work? And specifically, how does the pursuit of UHC relate to and integrate into women's health? Can you explain that relationship and why those two are mutual goals?
Thank you, Amalia. Can I start?
Yes,
just
please.
kicking us off. First, just applauding everyone who has been involved in pushing for universal health coverage at a country level, at a regional level, and at a global level. Because for us, we know that this is a measure of the world's commitment to ensuring good health and well-being for all. That's SDG 3. That is good. But healthcare cannot be universal if it doesn't include family planning. And too often, many of the UHC schemes do not. And that is a challenge because if you do not, as you said, I think it was in the previous panel, if you cannot measure it, often it may not be done. So we believe that for UHC, if you don't cost it and articulate what it is and make sure it's included in the benefit plan or in the payment plan of a country, it may not happen. So let's make sure as we pursue universal health coverage, we are not leaving women again paying out of pocket for family planning because we know that, as Byron was saying, they are customers, but often they pay for their own family planning commodities. And I'm talking even UHC from a private sector perspective, where many of the health plans do not cover family planning. And yet when we cost it and we include the return on investment for that particular plan, we could gain more from UHC. So that is a warning. FP2030 is working alongside many of our partners in program development, in advocacy and private sector to make sure we can have strong UHC commitment and structures that include family planning. And often it's not a lot of money to include for that pooled mechanism. You can include just a little amount and you find that you can cover more women with family planning. So we make sure that we don't marginalize women's healthcare needs as we advance universal health coverage. And again, the most important piece of this is the need to integrate care streams and scale up evidence practices with a proven success rate. One such success story is integrating family planning with routine childhood immunization or integrating family planning with postpartum family planning. You know, those are proven high impact practices that we could cost in universal health coverage and scale up in many countries. You know, Malia, the data shows that most women in the year after birth, when they give birth, they want to delay or avoid another pregnancy. But many are not using a modern contraceptive methods. As we are conducting some of the studies or accelerating plans for UHC. When women come back for routine postnatal care or immunizations for their babies, it's an opportune moment to counsel them on family planning options, but also to make sure that these are available. And lastly, we need as a field to integrate family planning with immunization, which has had only positive or even neutral impact on immunization uptake. It's important for us to do that because it doesn't affect the other sector. It has a positive impact on family planning uptake. And we are also seeing some great exemplars from Rwanda, for example, where 98% of women that were interviewed in one study supported the idea of integrating family planning service components into routine immunization services. And again, we need to do the same for postpartum family planning, where we are seeing countries like Rwanda, like Zimbabwe being exemplars in integrating this care. Now, it makes sense. No one wants to go to multiple facilities, multiple clinics, multiple pockets of funding. We need to integrate this with universal health coverage, and we look forward to working with many of you in the room as you advance this important global goal to integrate family planning within. Thank you, Maria.
Well, thank you for that. Indeed, that clarion call. And I know we're out of time, but let me just see if Jen and Byron, if there was anything else you wanted to add about this issue.
Yeah, I'll just say quickly, building on what Dr. Dube said, is that when we're thinking of health systems, they have to be responsive to her needs. And so we should incentivize those health systems to listen to her, to ensure that they have dignified care and empathetic care, and that they are really delivering on her needs based on her feedback.
And I'll just add that from a private sector perspective, making sure that when players such as FP2030 and PSI are working on the demand side, that we on the supply side make sure that she has access to products and commodities, so that that health systems are strengthened and that she can receive care when and where she wants it, and that she has options when she gets there.
Fantastic. Well, Samu, Jen, Byron, thank you so much for joining us and for all the work that you're doing on this issue and will continue to do. Thank you, everybody.
Thank you.
Please welcome back to the